And many families watching this story tonight live in the middle of maternity care deserts as hospitals close labor and delivery units due to financial reasons.
As news specialist Shelby Lofton found out, that vanishing access is forcing many women to drive hours to deliver their babies.
You don't know. Are you going to take a nap?
Women have been having babies since the dawn of time.
Mom Alyssa Vasey had visions of soft snuggles and sweet sibling introductions following the birth of her third child.
Now you're going to go night-night, huh?
Halfway through her pregnancy, she found out from a Facebook post that her plan to deliver at Evanston Regional Hospital was no longer possible. That hospital discontinued labor and delivery services in December. It was deja vu. Vasey's hometown hospital, South Lincoln and Kemmer, closed its labor and delivery unit while she was pregnant with her second.
I cried for like 3 days because I was just so sad. I love my OB.
Vasey and her husband considered their options and looked into Utah hospitals. But their baby was due in March, when dangerous, wintry conditions aren't out of the question.
Contractions hurt. Like, that's not really safe to be driving yourself 2 hours.
A road trip to a routine appointment cemented Vasey's decision.
My dad and I were traveling on I-80 through the Green River tunnels, and on our way back there was a big accident and the tunnels started exploding.
Not wanting to risk laboring on the interstate, she's scheduled to be induced at a hospital in Rock Springs, an hour and 20-minute drive from her home.
I really would not like to go through all this again. It was just too much.
Vasey says her son, Ian James, will likely be her last because of what she and other Wyoming women are going through.
Other women have talked about renting Airbnbs in Utah, so they're close. And then my other friend, she had her baby in the ambulance.
We've seen 4 birthing facilities closing in the last dozen years.
Honor Hill studies labor and delivery trends nationwide for March of Dimes. They call these maternity care deserts, and that desert is growing in Wyoming.
We know that many counties, about 11, are lacking a practicing OBGYN.
This used to be a labor and delivery room, and now it's been converted to a same-day surgery recovery unit. Many women who would have delivered their babies here in Rawlins are traveling to places like Laramie to have their baby.
This hospital has really seen some financial struggles.
Eric Boley, president of the Wyoming Hospital Association, took us inside Memorial Hospital of Carbon County in Rawlins. He told us the business of being born isn't good business, partly because of a declining birth rate.
But if you're only delivering 20 or 30 babies a year, but you have that overhead that's always in place and keeping the training and everything, it becomes really problematic.
And partly because of how many families pay for deliveries.
There's not a lot of money made because a majority of the babies in our state are born on Medicaid.
Another challenge, the state's abortion laws have made recruitment and retention of doctors and nurses more difficult.
There's a lot of concern about the fact that they could be found guilty of violating that new law.
What do you say to the women who are contracting in a car and feel like they have to drive miles and miles and miles because they don't have an OBGYN nearby?
Well, the flippant answer would be don't push, but it's tough, and it's why we're working on it.
He says Wyoming leaders are looking at what other states are doing for answers. March of Dimes proposes 4 solutions.
We very much encourage midwifery care.
Boley says state leaders are working on expanding their scope of practice.
We also focus on expanding access to accredited and licensed birth centers.
Wyoming is also examining how Alaska mothers are moved closer to delivery locations as due dates arrive. And finally, addressing the costs.
They don't make money off of us, so we don't matter.
Moms looking to hospitals in Utah have another financial concern.
Utah doesn't accept Wyoming Medicaid.
Vasey fears the obstacles moms like her face will drive families out of Wyoming.
If you're in the stage where you're going to have a whole family, why would you even start off here?
Reporting for KSL News, Shelby Lofton.
Well, to help fill the maternity care gap in Evanston, Intermountain Health just started a new program for new and expectant mothers. Women can now see a Utah provider through virtual and in-person visits.